Welcome back, ladies and gentlemen, dear colleagues. We thank you for your participation in this great forum. And it's always inspiring when we have different stakeholders. We kind of forget our silos and we try to all come together. When it comes to innovation, we know that we can only do so much alone. But it's a collective mind and the collective wisdom that when we come together, we can really take it to the next level. So I think the theme of this session is going to be that I'm sure all of you have heard how the recent focus on artificial intelligence and how this can really transform many industries, not only healthcare. But we want to, in this session, try to zoom in a little bit in more detail and talk about healthcare and artificial intelligence and see, what are the perspectives, what are the different angles that we have to view it with. And as a little bit of a background, AI or artificial intelligence is not something new. As many of you know, it goes back to the 1950s when the early work on AI and maybe even a bit earlier than that. So this is something that is coming back, and I think UAE government at the federal level, trying to align with the broader federal government. The federal government was very blunt and very bold in terms of making UAE's strategic decision to go to lead towards the fourth industrial revolution. So that's a basis where UAE has an artificial intelligence ministry and a minister, and almost all sectors in UAE, including healthcare sector, and within the healthcare sector, all the stakeholders, whether it's government, private, industry, we are supposed to have our own approach and initiative so that we can align together and we can work together towards this common goal. So with all this in the background, I think we know that people could be very skeptical about AI or artificial intelligence and have the simplistic view of, well, is AI is going to replace clinicians and physicians, to the other side of the spectrum where, given the huge amount of data that are generated every day, is not even comprehensible how a clinical person would be able to synthesize or think about this huge database without some additional help to try to make sense of this huge amount of data. And it will be nice to have AI or artificial intelligence try to rank and try to analyze and try to help, because AI in itself recently has, as we have heard, many new developments that AI is getting into, developing human skills in terms of seeing, the speech, the recognition, the cognition, etc. So without just going too much into more details, the way we will start this session is that we will go through some brief introduction to our guests. And it's great because we have different perspectives to enrich this discussion. So I would ask each of my colleagues from QUAY to just mention his name, title, and brief about what his company does. And then we'll just go to some broad discussions and questions and answers. And then we hope to finish on time and also open it up to the audience for a few questions from the floor. So let's start. Why don't you tell the audience about your name, your title, a little bit, maybe within 2 to 3 minutes, about your organization, what do you do, and let's move from there.
Sure, thank you. My name is QUAY FAHNESTOCK. I'm the Chief Technology Officer of a Tawazun offset company called Gulf 3D. What we do is we develop 3D virtual reality, augmented reality, maintenance, training, and operations applications. One of the issues when you work with a country that has people from all over the world is how do you train people regardless of language? So we do this visually. So some of the things we do for training lab technicians or even surgeons and nurses is we model equipment with interactive CAD files that allow you to show step-by-step procedures and animations and then be able to practice these virtually, right, which are all recorded in the learning management systems. So that's kind of what we do in a nutshell. We then take those same applications and deploy them in virtual reality applications so people can remotely train from one country to another. Because that's one of the issues is can you always fly an expert in? You know, maybe someone's not available, but with things like virtual reality and cloud computing, you now have the ability to do these very immersive applications and training remotely anywhere on the planet. So.
Excellent, QUAY. So, Hoda, let's just again give us a briefing about yourself, the organization, and what is it that you are responsible for in relation to our topic.
Thank you so much. So I'm HODA AL-KHZAIMI. I'm the director for Center for Cybersecurity, New York University, Abu Dhabi. I'm also a research assistant professor in Department of Engineering. In the Center for Cybersecurity, we work for a holistic mapping when it comes to addressing cybersecurity issues from the inception point of view in every platform. And we work, again, holistically and an interdisciplinary platform. That means our researchers they come from different backgrounds. They are either computer scientists, electrical engineers, or economists, or people who are working on biomedical research. So one of the issues that we are tackling this year and last year is how can we make sure artificial intelligence-based systems are inherently secure. And being inherently secure is a different component, and it's a complicated aspect because you need to make sure that these products that are being built with functionality in mind, they have security in mind first, as well as functionality and accessibility in mind. So this is one of the few research components that we're working on.
Excellent. So, Odin, please, you come all the way from France, right?
Sure, I'm coming from Paris. Hi everyone, bonjour tout le monde. So my name is Odin. I'm the head of the Acceleration and Startups program at Capdigital, which is the largest cluster in Europe. So quickly, what is a cluster? It's a non-profit organization which is dedicated to foster and accelerate the ecosystem for digital innovation. And my specific role, I'm not a data scientist or I'm not a doctor, but still I'm working every day with innovators that are startups, corporates, research centers and labs, but also institutions. And our focus on AI, we have three pillars. The first one is education, because we think that what you need to provide to train AI is data, big data. And for that, you need also to educate the population, because you and I here, we are convinced that technology is great to innovate and to cure ourselves better in the future. But 50% in France of the population is not convinced of that. So we have to educate the population as well to understand better why we need your data and how you can also provide your data in a secure way. The second pillar is, I would say, collaboration, because nowadays you have data in the hospitals, in the clinics, in the administrations, in the institutions, but all those data are not structured, and the public and private sector have their own data, but maybe they don't share it together. And startups, innovators, they need to access those data in order to build new AI and new artificial intelligence in order to develop health solutions. So we try to bring those people together and make them more aware that they have to collaborate together. And the last pillar is innovation. Obviously, we support research and development, and for that, we also behave as translators, because startups, researchers, private sector, they don't speak the same language. Sometimes they're looking for the same thing, but they don't even know it, and they don't know how to communicate together. So we behave as connectors and translators to make sure that all those people work together within the same aim and objectives to develop new solutions for the people and for health.
Excellent. Alexander.
Hello. So I am Dr. Alex Griffiths. I'm based at the London School of Economics. I'm a data scientist, and my colleague and I have founded our own company based on some research that we've done. And we've partnered with Cognit here in the UAE, who are an AI company. And what we specialize in is looking at how artificial intelligence and machine learning can help us get immediate and valuable feedback from patient experience data. So if we take England, where I'm from, as an example, there are hundreds of thousands of patient comments left unsolicited every year via social media, so Facebook posts, Google reviews, reviews on sort of government-run websites, and of course Twitter. And the problem we have had in the past, and it's a nice problem to have, is that there has just been too much data for anybody to do anything with. And what we found, if we train our machine learning models to read through these hundreds of thousands of comments, identify what's relevant, flag a department or a specific hospital, and sort of sentiment score it, we can gain some very valuable insights into patient experience. And if we combine these multiple data sources, we actually come up with a very effective predictor of the outcome of in-depth quality inspections in the UK. So what we specialize in doing is using machine learning and artificial intelligence to access data that wasn't previously accessible and deliver sort of new, quicker insights into the patient experience.
This is really great because, as I said, we have a diverse group that, the panelists are coming from different perspectives, and that's why I think it's great to enrich this discussion. So let me start with QUAY. In healthcare, frequently it is the case that when you look into the details of the delivered care, it could be that the care is good enough, or sometimes there are no shortcomings when it comes to the delivered quality of care, and yet we sometimes fall short of making sure that the patients and patient populations are on the same page and they understand the complexity of the disease. Because what we clinicians, and just a little bit about myself, I'm a transplant nephrologist. I still practice, and also I work at a health system as a chief academic officer, and also have some public health background. Because sometimes what we assume as a clinical staff is that we may think that patients do exactly understand what we mean when we explain to them. So my question to QUAY is about, with your work about virtual reality, assisted reality, 3D, how do you think expanding on the applications of these technologies to target more innovative ways of engaging the patient population that affect them perhaps accepting their diagnosis, or even if they became convinced to better comply with the prescribed treatment? So how do you position these new technologies of patient education into augmenting the way healthcare is delivered in this day and age?
Well, I think there's a lot of different ways that AR and VR specifically can be done for giving some of the families a deeper understanding of what's happening. Because with VR, you can create virtual environments, right, where you can kind of simulate what's happening in the body and show, how a drug is being delivered, right, or how an imaging system is being working. If you put barium in the system, what's happening, right, and how you're identifying a malignant tumor, and then what the procedure is. So this can all be simulated and shown to the individual or their families, so they have a deeper understanding of what's going to happen. And it's done in a visual way versus someone who doesn't understand the vocabulary of a trained doctor or someone who went to medical school. Because, again, when you have a country where people come from all over the world, their knowledge of some of that specific vocabulary of the medical field, a lot of that's going to go over their head. But this can be done in a visual way that's very easy to understand because they see it with their eyes and they get to experience it.
And do you find that, for example, taking these technologies even upper stream to the way we introduce health education classes to school-age children, that they on one hand they get a quick introduction to technology. So if we move these concepts of chronic disease to an earlier age with new innovative ways, do you think there is a room for that and that could have a broader impact?
Oh, absolutely. I mean, children can practice basic first aid procedures, right? They could be wearing VR headsets, right, and simulate, all right, if someone has to do CPR, they can practice on the dummy, but also see the response, right? You know, you can see that person breathing afterwards. You can show them that in an ongoing way that's more interactive than some of the tools that they have now. I mean, they have dummies now that have reactions, but a lot of those are expensive, where you can do this in a virtual environment and change the CG environment much quicker and also show more scenarios.
And I think, you know, us sitting here at NYU Abu Dhabi as a major academic institution, we should not also, not reflect on perhaps these technologies, the way we advise the new generation, if they were to consider, healthcare career. In the past, it used to be that you go to a doctor, you go to a friend, a family friend, and say, should I choose to become a doctor or some other profession? So this in itself could also be a way to have a better career advice to the younger generation to see if they would be intrigued to get into the healthcare business.
Yeah, for instance, everybody in school used to dissect frogs. Now, this is something they could have a CPR dummy, wear some augmented reality glasses, and see how the circulatory system works, see how the heart beats, right? The kids will become more inquisitive about what's happening inside of the body because they can visualize it in these ways that are so realistic that it's really captivating for young kids' minds to actually try.
Excellent. Well, let's go to HODA. I mean, you touched upon a very important concept of trying to inherently build a system that is secure, because I think the dilemma is always, the data security, and so it's a pendulum. If we focus too much on the security side, it sounds like, we are in the tail of innovation and we are lagging behind. And if we don't address these issues at the right time, in the correct manner, we could be exposed, and we have a responsibility towards the public, towards the health system. So how do you draw the balance between having a secure system and address the cybersecurity issues, but yet, this not be a hindrance towards innovation? And how do we strike the right balance between openness to innovation and access to data, and at the same time, be as secure as the public expects us to be?
Okay. I'd like to use the terminology nice problem. So we do have a nice problem with us when we look at AI-enabled systems. Because end of the day, they are the same generic platform. They rely on machine learning, they rely on cognitive systems, they rely on different terminologies that you can tackle. So we are looking at the wider application of this AI-based system in biomedical fields. We could see them right now in automated surgical platforms where you're trying to have a robotic surgery system happening, and epidemic control and epidemic management, where you're trying to simulate, for example, for certain population, if you will have certain epidemic widely spread, then you will use simulation methods and pattern recognition and computational platforms to understand how would this epidemic happen. The same thing when you want to simulate personalized medicine or personalized drugs within a certain customized platform for a specific population, especially here in UAE, I would say, because we have certain categories of diseases like diabetes and blood pressure and all of these things. So you need to build a specific customized, personalized medicine system. That being said, we come into the equation to highlight the gaps. We want to understand, is the hardware or software robust enough and strong enough to take the security that we can implement? This provides an interesting pressure on us in the field to make sure whatever we provide in terms of security measures, if we're providing, for example, let's say, integrity platform or encryption platform to protect the confidentiality of the data or to protect the data that's being manipulated in the system, then we're not introducing an extra computational overhead on the system, because that system is meant to function within a specific perspective to provide functionality for medical platform. It's not supposed to function and to have an overhead functionality for the security aspect. So we have to make sure that our security that we built for the system is an appealing perspective for that platform, being in hardware or in software. So this is one of the major research fields that we are tackling at the moment, being in Europe or in the US, where we're trying to make sure that we can build security, for example, for energy harvesting devices. And energy harvesting devices, they have only, most of them, they have only an allowance of 1 degree of temperature change. And when you introduce security on this, then the computational overhead might push against this 1 degree of change. So all of these interesting scenarios are being there in the field, and we're trying to make sure that we, for example, if you're building your machine learning techniques, then we can also fool these machine learning techniques. We can fool these classifiers. We can introduce what we call false positive inquiries into the system, and then if you're dealing with decision-making AI-based system, then you can make a catastrophic decision by giving the wrong medication or the wrong dosages or the wrong decision that will have a catastrophic impact on the patient. So all of these, I would say, nice, negative scenarios, we're trying to simulate, because end of the day, we're trying to make sure that we avoid this happening.
How do you rank the security risks? I mean, do you go with 100%, or do you profile the risk and benefits and then see if different organizations have a different, let's say, risk appetite to see, the balance between risk and also the business risk. So there is a legal risk and business risk. If we go too far towards legal risk, we may have a broader business risk. How do you profile the legal risk or the cybersecurity?
So this is an interesting question, because we cannot guarantee 100% security, and we cannot guarantee 100% resiliency against a certain risk. What we can do is do proper research to increase the probability of certain incident or certain vulnerability not happening within the system, and reduce the risks associated to that. Okay. And the dilemma that we have on this scenario is we deal with a health system, and in health system you have certain standardized process of HIPAA, for example, or different security aspects that you have to tackle. And this standardization process is very slow. Again, I've said it before, I'm going to say it again. It's very slow to standardize one technology aspects when it comes to healthcare or any industrial system. But to have an attack, it will take you seconds, maybe. And the evolution cycle of attacks is way faster than the standardization process of industrial concepts.
Well, we have this session about, how AI is going to change the future healthcare. If we talk, Odin, to you about, the setup that you have in France, the way it's non-profit, and you try to bring people together to collaborate. How do you address issues like intellectual properties? How do different parties come to the table to collaborate around artificial intelligence projects that are promising? You know that one party could not maybe have all the solutions, so if different parties come together, maybe a health system that has all the hospital data versus industry versus investment, how do you address that these parties, they collaborate, but upfront they can agree in how to collaborate and also how to share their successes?
Thank you, great question. Many ways. First of all, we have an organization in France which is dedicated to intellectual property. So they draft the standards and they try to educate also everyone on how you can protect what's yours and what's not. And at the same time, what we are trying to build is trust and confidence between all the parties, because we, as a cluster, we are the third trust party. We are non-profit, and that's a great asset for us because we can talk to everyone with the same positioning, and try to bring them together with the trust, because they trust us. So we are always in the middle of the relationship, and we make sure that everyone is agreeing before even collaborating on all the terms. So it's not an easy, it's not an easy task, I would say, but still we have in France many public institutions and organizations that are protecting and working on those aspects.
And how do you see some AI applications when you have a multi-stakeholder come together to change the way medicine is going to be practiced? How artificial intelligence could, when you have different parties adding value to each other, do you have some highlights of certain areas that you think are more promising or examples?
As I said, if we go back to from scratch, what's essential, it's the data they have together. Many of them, they have data that are not clean. They have many data, for sure, many of them, but they don't share it, and it's not clean enough, it's not structured, so they can't use it. So we are trying to, first of all, bring them all together to at least share this data, to work on projects together. And then we build consortium for research and development that are financed by the state, the French state, and that brings also all the frame and the secure frame to make sure that they can work on together on projects. And as potential outcomes, it's very interesting when you have corporates or institutions that have data or issues, but they are not very agile to actually innovate. And that's where we bring the startups and the researchers to bring intelligence and agility, to make sure that those people that have many great ideas, maybe they can't implement it. So we bring together the startups and the corporates and the institutions that don't have the same way of working, so we still have us to be in the middle of this and make sure that they work together. So yeah, to answer your question, that's the key for us. It's always trust and confidence between the parties, and most of all, it's to make sure that they will go on the same directions. And that's not easy, because many of them, they have the pride and they want to end the project alone and find themselves the solution, but they won't find alone. They need to benefit from all of them, their strength. Some of them have financial strengths. The startups have the agility to make sure that they can implement very quickly or innovate very quickly using very nice artificial intelligence processes and so on. So yeah, that's collaboration for us, the key to innovate.
Okay. Excellent. Alex, you come from an interesting background, so the health economics, being data scientist, and you also work with Cognite in IBM Watson. So two questions to you. One is, do we have data that artificial intelligence improves the quality of care, and can we reflect on how this could be the case? And also, many organizations struggle with the concept of how much should they invest? How do they measure the return on investment? What are some economic aspects of trying to leverage AI, artificial intelligence, to improve healthcare? But I think the quality is one, and also some of your background and your reflection, and I believe you have done some papers to look into certain aspects of this.
Okay, thank you very much. So in terms of, do we have data available? Yes, there is a huge amount. We can see today that some people have done some fantastic things using AI with the data that's available. But just in terms of, so if we take the UK as an example, we have a wealth of performance data around sort of mortality statistics, readmission rates, patient surveys, clinical audits. More or less everything is quantitatively measured. And that has proved very useful in the past to some extent. But what we found in some of the research which I've done, which you've mentioned, is that not all data is useful. Okay, so a lot when the regulators have looked at a lot of this data and they've gone to the hospitals with the higher mortality rates or the high readmission rates, for example, they often find that things are fine on the ground. And vice versa with some of the hospitals with better data. So it can be useful, but it can also be misleading. And that's what led us to start looking for new data sources that we could capitalize on. And that's how we arrived at looking at this sort of vast amount of social media data that's available. And this is data that's, it's already been collected. It's incredible. There's no burden on hospitals for this data to be gathered. There's no burden on regulators or anyone else to gather it. But this new sort of data source that couldn't be comprehended or analyzed before offers us a huge kind of number of advantages. And so it gives us patient feedback in near real time, which is something that hasn't been available up until now. It's something that we have the ability to analyze all stages of the care journey. So if we think back to old systems where we just had patient surveys, you would get a sort of retrospective view on quality, and that would tend to be quite biased. So we work with one NHS trust in the UK who analysed the respondents to their patient survey and found that the average age of a respondent was 78, which is, obviously they occupy a lot of the care, but it's also a slightly skewed view of quality. So using AI to sort of address these new data sources, we also get a more balanced view on quality. We get to see what it is patients really care about themselves. So we're not just seeing responses to questions that are being posed, but we're seeing proactive sort of patients informing us where there are problems in quality and what can be done about that. And often that can be a very simple economic thing. So one hospital we've worked with has vastly improved their patient experience score, spending very little money just by investing in one more person to answer the phones. Because what used to really annoy people was they'd call you up and they'd be calling and calling for half an hour and nobody would ever answer. So it offers us insights into how to inform patient care quite cheaply. It gives us insights that are more granular than before. So when people tend to complain or praise the care that they receive, they tend to talk about specific physicians or wards or departments rather than large hospital groups. And it also allows us to sort of proactively search for specific concerns. And so if, say, here in UAE, you had a drive to improve oncology, we have a massive data we can actively search through and see what patients are saying about oncology. Does that differ from certain locations? Does it differ amongst the people that are saying it? And take a really sort of proactive view. So I think there's huge scope with the data that's available now with systems like IBM Watson to improve quality.
It seems that with artificial intelligence, there is going to be a paradigm shift where the traditional evidence-based medicine, where we need the evidence to be there, sometimes with randomized controlled trials, that is very expensive to do. And I think some papers suggested that from an evidence-based medicine, a discovery or some new findings to an implementation, it could take an average of 17 to 19 years. So it seems like this could be, with the way you say, with the ease of information, rather than evidence-based medicine, but this is like intelligence-based medicine. Do you see that the close proximity or the usefulness of having data scientists become part of the clinical teams in the hospital, so that in that setting the right question is asked, and the clinical group can do so much, and actually their input is very important to highlight so that we are fixing on the right issue to fix. But at the same time, a close collaboration could be built with a data scientist so that, the turnaround in asking the right questions to querying the huge database that is beyond the human cognition. How do you see data scientists helping in this intelligence-based medicine approach?
That's a very good question. So I think there are two examples that spring to mind. And one is, one area that's often very costly and time-consuming is the approval of new drugs by various sort of government authorities. And one example my colleague researched was seeing if they could fast-track approvals based on data science methods. And so there's been a lot of work done in the US to examine if we know that a certain drug is safe, if we make a slight variant of it, do we expect that'll be safe as well? And they found that in doing so, they've been able to sort of fast-track applications and approvals for drugs, from years down to months, which is obviously a huge cost benefit for everyone in the system. And in terms of involving data scientists in the sort of clinical settings, I suppose I'm slightly biased. I think we should always employ more of us. But I would say certainly I think there's a huge advantage in doing so. And I also think there's a lot of cost benefits to be gained, not just from having a data scientist sit there and helping you ask the right questions, but also we have a huge amount of healthcare data, that we can draw conclusions from without needing to do new research. So we talked earlier here in the UAE about having records of every sort of every transaction in a hospital. We have a similar thing in the UK. A few good data scientists can do an awful lot with that data to save an awful lot of money and improve healthcare.
I think we'd like to open it up to the floor for a few questions before we try to wrap it up. But as I think please, if we can distribute the microphones for people who have questions. Any questions from the floor? Okay. I think as the audience is thinking whether we have quite a few questions, we know that AI, artificial intelligence, have had some applications on the diagnostic side, pathology and radiology, on the genetics and precision medicine, on even, since this topic is about innovation, in sometimes leveraging AI to validate innovation and to automate as much possible as innovation so that, you can have the cycle of innovation be faster with the... So to your mind, which one do you think is more promising, or it's all needs to come together? Because I think, the impact of AI in medicine, you have different backgrounds, but what do you think? Which areas is kind of your organization is more closely working on, and what do you think? AI with diagnostics, AI with therapeutics, new discoveries?
I think using AI to simulate risks is a big benefit, right? They're using this right now with CRISPR systems, and Microsoft's building some tools like Azimuth, where it's, when they look at editing a specific gene, the big issues are if they're off target, they could have a fatal effect. So building more and more of these tools using AI to kind of simulate all the potential off-target effects, all the probability of very bad side effects before something happens, that really affects the way innovation, because now you can start eliminating a huge percentage of these trials that are going to cause catastrophic actions, right? Okay. So I'm kind of interested to see where that also is being applied, because using it not just to solve the problem, but to identify and quantify the problems.
Okay. Do you have any?
Yeah, just to add something. For us, the focus, we have many companies developing solutions to prediction, of course. Some of them for cost efficiency, how to better diagnostic before the diseases, to make sure that the doctors can spend time on what really matters and not the pre-diagnostic before. So that's something that can be automated thanks to AI. We have actually an example of a company over here which is doing that, so it's very interesting. Okay. At the same time, I would say that customer experience, we have to think about the patients. They have to get a better experience when they get to the doctor and when they have to interact with the hospital. And for example, for the chatbots, that can be good to prevent the people of having bad habits. So you can have chatbots interacting with the patients at the same time. So that's the kind of example we have, the company we have nowadays. It's very simple things at the same time for chatbots, for example, but it's very useful.
I think we have one question from the audience. I saw a hand, and then we'll close for the next session. Do we have a question?
Yes, thank you very much for the insightful panel. Dr. Nadir Khassani from Abu Dhabi Polytechnic. I have a question about the availability of the data. Are the health authorities in UAE are willing to share the data with the research institutes over here? As he mentioned, in UK, they have structured data from surveys, from health authorities, from different even hospitals. I mean, for AI application, it's very important to share such data to conduct research. Of course, privacy is concerned for the patient. So availability of data for researchers is very important.
Well, I think having being part of, listen to the previous panel with the Undersecretary, I think the willingness, the political will, and it's there. So I believe we need to address the elements that respects the security aspect. And I think the validity, the more we share and we give feedback to those people who are sharing their data, the more we can rely more on the data and go granular and maybe connect it with the patient files and try to see. And also, of course, engage patients if we are going to do research that we need their consent. Any final remarks before we conclude? I think for the next, you have one question, please.
My question is for Gulf 3D. You mentioned that you've set up a project with Offset's Tuazun. Can you give some advice to the young entrepreneurs that are here today that are being awarded for their inventions and their patents about how you set up a company here, specifically with Offset's Tuazun?
Well, I think one of the things they're doing is trying to support building new industries and companies that provide jobs to young Emiratis, but also build some technology transfer and capabilities to the UAE. So in our case, we're creating software applications here and taking students from intern level out of the universities and training them to be 3D artists and programmers. So I think it's something to think about that, when you look at your talent base, you need to think about cultivating the people that you're going to hire and getting them at an early stage and developing your talents. You're not necessarily going to find a lot of very experienced people because you want to build your own network of people from an early stage by working hand in hand with the universities. Start talking to them when they're sophomores, taking them as interns in their junior year, and if they do well, bring them on as soon as they graduate, and offering summer jobs and even sending them to additional classes to build the skill sets that you need for your company. So.
Thank you very much. So I think because of time, we'll wrap this session. Please join me in thanking the panelists for their contribution. Thank you.
Okay. Thank you.
Thank you.